Hello, I'm Mort Kern from the University of California, Irvine in Orange, California. I'm here with the CVN Dynamic editorial interview for JACC Imaging Journal. Today I have with me the author of our paper, Dr. Takashi Kubo from Wakayama University in Wakayama, Japan, and our editorial commenter, Dr. Renu Virmani from the CV Path Institute in Gaithersburg, Maryland. And I wanted to have Dr. Kubo talk to us about the paper he wrote and what this means to us.
Yes, thank you. We used OCT to evaluate vascular responses after limb-threading stent implantation between unstable angina pectoris and stable angina pectoris. OCT examinations were performed at pre-PCI, post-PCI, and at 9 months follow-up. And we evaluate plaque rupture and intercurrent thrombus, and think up to fibroadenoma at pre-intervention. And after PCI, we evaluate stent malapposition and tissue protrusion. And at 9 months follow-up, neointimal uncoverage of stent and residual plaque rupture behind the stent. Our major findings of this study is these vulnerable regional features and inadequate stent findings were observed more frequently in unstable angina pectoris compared to stable angina pectoris.
Great. Dr. Virmani, what do you think this means for us?
This is a very interesting finding because what we have looked at autopsy, which are quite similar to your results, we have looked at patients who had either vulnerable plaque or had plaque rupture, and then followed them at various intervals because we don't have a 9-month like you do, ours are autopsy, so it's a little variable. But we looked on an average beyond the 30-day period, and what we found was that the area which was where the plaque rupture had occurred, the coverage of the stents is very poor, and sometimes there is plaque protrusion, and this seems to persist afterwards. Whenever there's plaque protrusion, specifically over there, you do not see much coverage of the struts. On the other hand, we compared to stable plaques that had a thick fibrous cap.
Yes.
And what we found was that those were better covered.
Yeah.
So I think your findings are very relevant to overall our understanding of plaques, which I find fascinating because I think ultimately what's going to happen is that we are going to start using stents only, or drug-eluting stents perhaps more often in stable as compared to unstable plaques because they don't heal very well. And I think that's what I find as most fascinating, that our autopsy studies are validated like a 9-month study on an average.
Well, I think this is important observational work that you've produced in terms of translating what we knew from pathology into living patients, translating the findings into the unstable plaques, and then the differences when we stent in unstable plaques versus stable plaques. Now the next piece of the puzzle to come, of course, will be the clinical outcome relevance over the next year. We didn't have that piece, but it's certainly an important observation that we've not had available to us with other modalities. So I think your work really is excellent.
I just want to end up saying what we found, which was different from yours, is we show actually thrombosis associated with those that are not well covered as compared to those that are covered.
I want to thank you both very much for your comments. I think this is highly educational, and I hope the readers of the journal appreciate these fine comments by our authors and editorialists. Thank you.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.